What if I told you that your birth control might be influencing more than just your cycle? What if it could be affecting your mood, your attraction, your anxiety levels, your confidence, and even your personality? And most women were never told this. Now, before you panic, this is not an anti-birth control video. This is an informed consent video. Because millions of women are prescribed hormonal birth control every year, and many are never told how deeply hormones influence the brain. We live in a world where birth control is handed out like a routine solution for acne, for cramps, for irregular cycles, for pregnancy prevention. And while it absolutely serves those purposes, the conversation almost never goes deeper than that. No one tells you about the neurological side. No one explains what happens inside your brain chemistry when you introduce synthetic hormones into a system that runs on its own natural rhythm. And that silence, that's where the confusion starts. Today, we're going to talk about how hormonal birth control works, how it affects neurotransmitters, why some women feel not like themselves, what the research actually says, and what you can do if you feel different. Let's get into it. 1. How birth control actually works. Most hormonal birth control, including the pill, patch, shot, ring, and hormonal IUD, works by suppressing ovulation. It basically tells your brain, you're already pregnant. No need to release an egg. To do that, it alters estrogen and progesterone levels. But here's what's important. Estrogen and progesterone don't just control reproduction. They also influence serotonin, which is your mood chemical. They influence dopamine, which drives motivation and pleasure. They influence GABA, which creates calmness. And they influence your cortisol response, which is how you handle stress. Your brain has hormone receptors everywhere, in the prefrontal cortex, the amygdala, the hippocampus. These are the areas responsible for decision-making, emotional regulation, memory, and stress response. So when you change hormone levels, you can change brain chemistry. And when brain chemistry shifts, personality traits can shift too. This isn't speculation. This is basic endocrinology that isn't communicated to patients nearly enough. 2. Mood changes and emotional blunting. One of the most reported side effects of hormonal birth control is mood change. Some women feel more anxious, some feel more depressed, some feel more irritable, some feel emotionally flat, and some describe themselves as just feeling numb. There's even a term women use, I just don't feel like myself. Research has shown that some forms of hormonal contraception are associated with increased risk of depressive symptoms, particularly in teenagers and young women. A large Danish study, one of the most comprehensive ever conducted on this topic, found that women on combined hormonal contraceptives were significantly more likely to be prescribed antidepressants afterward. That's not a small signal, that's a pattern. Now here's the key. Not every woman experiences this. Some women feel great on birth control. Some feel worse. Some feel neutral. But the emotional blunting effect is something many women describe, where highs aren't as high and lows aren't as low. Almost like your emotional range narrows. You can still function. You can still go to work, maintain relationships, get through your day. But you might notice that things that used to excite you don't anymore. That you laugh a little less. That music doesn't hit the same way. And that can absolutely feel like a personality shift. Because it is one, it's subtle, but it's real. 3. Attraction and partner preference. Now this is where it gets fascinating. There's research suggesting hormonal birth control may influence attraction patterns. Naturally cycling women often experience changes in attraction across their cycle, particularly around ovulation. During peak fertility, many women report being more drawn to certain types of faces, voices, and even scent. But when ovulation is suppressed, those cyclical shifts disappear. Some studies have suggested women on hormonal birth control may be more attracted to certain personality traits, particularly men with similar immune profiles, than they would be off it. This ties into research on MHC genes, major histocompatibility complex, which plays a role in immune function and is partly communicated through scent. The theory is that naturally cycling women tend to be attracted to men with different MHC profiles, which could lead to stronger immune diversity in offspring. But hormonal contraceptives doesn't mean your relationship is fake, your attraction isn't real, or that you'll suddenly dislike your partner. But it does mean hormones influence attraction more than most people realize. Some women who stop birth control report feeling a shift in how they see their partner. Sometimes for better, sometimes it raises questions. And if hormones influence attraction, they can influence behavior patterns too. That's powerful. 4. Anxiety, stress, and cortisol. Birth control can also affect how your body responds to stress. Estrogen and progesterone influence the HPA axis, the system that regulates cortisol, your primary stress hormone. Some women report increased anxiety, feeling on edge, panic symptoms, and difficulty regulating stress. Others report feeling calmer. Again, this is highly individual. But here's something worth understanding. Cortisol dysregulation doesn't always feel like stress. Sometimes it shows up as low energy in the morning, a feeling of dread you can't explain, heightened startle responses, or just a baseline tension in your body that never fully goes away. If you've ever thought, why am I more anxious than I used to be? It's worth considering hormonal influence. Because personality traits like confidence, boldness, and sociability, they're partially shaped by how your nervous system functions. A nervous system running on elevated cortisol is going to produce a different version of you than one that's regulated and calm. 5. Libido and identity. Let's talk about libido. Hormonal birth control can lower testosterone levels in women, specifically by increasing a protein called sex hormone binding globulin, or SHBG, which binds to testosterone and reduces its availability in the body. Testosterone isn't just a male hormone. In women, it plays a role in sex drive, motivation, assertiveness, confidence, and even cognitive sharpness. Some women experience decreased libido, some experience vaginal dryness, some feel less spontaneous desire. And here's what makes this particularly tricky. For some women, even after stopping hormonal birth control, SHBG levels remain elevated for months. That means the effects on libido and motivation may not immediately reverse. When libido changes, identity can feel different. If you used to feel more sensual, more flirtatious, more connected to your sexuality, and that changes, it can feel like your personality changed. Not because you changed as a person, but because your hormonal environment changed. And for many women, they didn't even realize something had shifted until they came off birth control and felt it return. 6. Why doctors don't always talk about this. Most doctors are focused on preventing pregnancy, regulating periods, and managing acne or PCOS symptoms. Mental and emotional side effects are often considered secondary. Also, large population studies show many women tolerate birth control well. So the conversation becomes, it's safe and effective. But safe does not mean side effect free. And there's another layer here. Medicine has historically underinvested in studying female hormonal health outside of reproduction. The research exists, but it's newer, less funded, and less integrated into standard prescribing conversations. Because emotional shifts are subtle, many women don't connect the dots. You started the pill at 16 for acne. By 17, you felt a little flat. By 18, you thought that was just who you were now. Especially if they started birth control as teenagers, when personality is still developing, they may not know what they feel like without it. That's not a minor thing. That's a woman who has potentially spent years not fully knowing her natural emotional baseline. 7. Important balance. It's not all negative. Hormonal birth control has helped millions of women, offering freedom, autonomy, pregnancy prevention, and symptom relief. For many, mood improves, PMS eases, acne clears, cycles regulate, and endometriosis pain is managed. For those with PMDD or severe period pain, it can be life-changing. This isn't a fear-based message, it's about awareness. Birth control can be incredibly helpful and have real neurological effects that deserve honest discussion. Your experience might be affecting you. If you notice emotional flatness, increased anxiety or depression, a drop in libido, major personality changes, brain fog, disconnection from your emotions, or shifts in relationships after starting birth control, it's worth evaluating. Pay attention to how you feel during placebo week and track any changes in motivation or drive. Don't quit abruptly or make impulsive decisions. Focus on gathering information. Keep a record of your symptoms and bring it to a healthcare provider who will take your experience seriously. 9. What you can do. If you suspect birth control is affecting you, start by tracking your mood daily in an app or journal, noting energy, anxiety, libido, emotions, and motivation. Compare how you feel during placebo week versus active pills. For many, this is the clearest window into hormonal influence. If differences stand out, that's valuable information. Discuss non-hormonal options with your provider, like the copper IUD barrier methods or fertility awareness techniques, And consider different pill formulations since estrogen doses and progestin types affect the body differently. Support your nervous system with consistent sleep, adequate protein, stress reduction, balanced blood sugar, and enjoyable movement. Sometimes the effects are due to formulation, dosage, or other factors like stress, nutrition, or thyroid health. The goal is informed choice, not fear. Here's what I want you to remember. Hormones shape brain chemistry. Brain chemistry influences mood. Mood influences personality expression. That doesn't mean birth control is bad. It means it's powerful. And anything powerful deserves awareness. You are not just a body that needs to be regulated. You are a neurological, hormonal, emotional ecosystem, and every input matters. If you've ever felt different on birth control, you're not crazy. You're not dramatic. You're not imagining it. And you're definitely not alone. Millions of women have felt exactly what you're feeling and couldn't find a name for it. This video is that name. Comment below. Have you ever felt a personality shift on birth control? And if this video helped you understand your body better, subscribe for more evidence-based women's health content. Your hormones matter, your mental health matters, and your informed choices matter. I'll see you in the next video.